Hello, everyone. Thank you so much for joining us today. It's a pleasure to see so many faces. This is our third BLS webinar of the inaugural Lymphedema Awareness Month. So it's a real pleasure to be joining you today. And boy, have I got a treat for you today. So I'm Becky Elwell. I'm a lymphedema nurse, and I'm also now working for a community interest company, Accelerate, based in London, and we manage people living with lymphedema and with wounds. And I have two amazing speakers today that I'm delighted to be able to introduce you to. So we have Justine Whitaker with you, who I'm sure needs no introduction. Justine is a nurse consultant in lymphedema and a senior lecturer at the University of Lancashire. And we have Debbie Provan, who is an honorary lecturer at the University of Glasgow, and she's also a clinical advisor and registered dietitian. And as you all know, the session that you've come along to today is entitled How Does What You Eat and What You Drink Affect Lymphedema and the Management of Lymphedema. Today's webinar will begin with a presentation, and then we're going to have a live Q&A with our speakers who are happy to answer any of your questions. So please do put them in the chat, and please do let us know where you're listening from as part of Lymphedema Awareness Month. And without further ado, we'll start our presentation from Justine and Debbie. Enjoy.
Hello everyone, today's session is titled How Does What You Eat and Drink Affect Lymphedema and Its Treatment? I'm Debbie Provan and I'm a registered dietitian, I'm a clinical advisor and I'm also an honorary lecturer. And I recently completed my PhD which looked at body weight in managing lymphedema. I'm going to be presenting today with my colleague Justine Whitaker. Justine is a nurse consultant of Northern Lymphology and a senior lecturer at the University of Lancashire, and she works both clinically and academically. She's got over 30 years of experience in managing lymphatic conditions. Today we're going to cover a couple of different objectives. So I am going to help you understand what makes a healthy diet and help you to consider and incorporate weight management approaches into your lifestyle or treatment plans if you're a lymphedema practitioner. And Justine is going to help you understand why a healthy diet and weight management should be considered as part of a lymphedema management programme. And she will also consider the cornerstones of lymphedema treatment and how body weight and shape may impact those. So to start, I want to talk to you about what makes a healthy diet. The Eat Well guide is likely to be familiar to you. It's a guide for the general population and it shows the proportions in which different types of food are needed to have a well-balanced and healthy diet. However, the proportions shown are representative of your food consumption over the period of a day or even a week, not every meal. The Eat Well guide recommends we eat at least 5 portions of a variety of fruit and vegetables every day. Each meal should include whole grain versions of starchy foods, for example, potatoes, bread, rice, pasta, chapatis, etc. And we should have some dairy or dairy alternatives such as soya or almond milks, etc. We should also eat some beans, pulses, fish, eggs, meat and other proteins, including 2 portions of fish every week, one of which should be oily. And by oily fish, I'm talking about things like mackerel, sardines, salmon, fresh tuna, but not canned. We should also choose unsaturated oils and spreads and eat those in small amounts. And finally, we should drink 6 to 8 cups or glasses of fluid every day, limiting or avoiding alcohol, caffeine, fizzy drinks, etc. The emphasis of the Eat Well guide is slightly different to that of a Mediterranean diet, with the latter focusing slightly more on plant-based foods, with less dairy, more moderate portions of fish and poultry and minimal red meat recommended. However, both the Mediterranean and the Eat Well guide promote fruit, vegetables, whole grains and lean proteins. And the combinations in both are well researched and scientifically proven to reduce chronic conditions associated with inflammation. So whilst this might be familiar to many of you, it's likely that you've heard conflicting messages or additional messages that have left you unsure of how to move forward. Health conditions, dietary preferences, allergies and intolerances and activity levels might result in you needing to make some alterations to those guiding principles, and we can cover more on this in the question and answer session if helpful. So when it comes to weight management specifically, there's no one-size-fits-all approach. I've mentioned a few common dietary approaches here. Very low-calorie diets are usually made up of meal replacements in a powder or liquid format. Low-calorie or calorie-controlled diets are typically those which an NHS or commercial slimming organisation would promote in the first instance. And low-carbohydrate or high-protein diets might also be known to you as the paleo diet, keto diet or Atkins diet. Limiting a diet to specific foods, for example, eating only soups or salads for a week or two at a time, or omitting whole food groups such as carbohydrates, fruits, dairy or fats is another approach. Limiting timing of food intake may be known as intermittent fasting, where 2 days of the week, either together or separate, a person will eat around 800 to 1200 calories, and then on the remaining days of the week they either aim for a healthy balanced diet or they eat to their preferences. Whereas time restricted eating might mean that a person doesn't eat between set hours, for example, after 6 p.m. or before 9 a.m. Weight loss drugs such as appetite suppressants or those that restrict absorption of fats may be prescribed, or injections such as Wegovy, Ozempic or Mounjaro are getting a lot of attention currently, especially for those living with diabetes. Weight loss surgery may include liposuction, gastric bands, balloons, sleeve gastrectomies or gastric bypass. And finally, somebody may opt for an increase in exercise levels, or that may be combined with one of the approaches mentioned already. Each approach here is likely to yield results, at least in the short term, because every one of them is likely to create the conditions that result in an energy deficit. However, long-term results vary and are very dependent on the individual and how well suited that particular diet is for the individual's circumstances. If the dietary changes can't be maintained in the long term, then success is unlikely. In addition, if results achieved do not meet individual goals, it is likely they'll become despondent or look to another solution. So it's essential that we understand goals from the outset and that those goals are realistic. Consistency and continual adaptations are necessary, especially as weight loss is achieved and energy expenditure starts to decline. These barriers and challenges that I'm touching on here are why weight cycling is common. And by that I mean weight loss is achieved, then weight is regained, and then lost again, then regained, and so on, as individual diets and then returns to previous habits. Weight cycling could do more harm than good in the longer term to both mental and physical health. As a result, embedding behaviour change initiatives in any approach, including long-term follow-up, other psychological support, encouraging ever-increasing levels of physical activity, and potentially utilising pharmacological or surgical interventions might support better long-term outcomes. Alternatively, a weight-neutral approach with a focus on health and health outcomes rather than weight specifically might be preferred and also be the most appropriate option. So, going a little bit further in considering what strategies might work, it really is important to do a full assessment of an individual's current dietary intake and the reasons for that diet before launching it into making changes. Social, environmental, financial, and practical factors all have a part to play in the dietary choices, and long-term changes are likely to be unsustainable if the elements are not considered. If you're a lymphedema practitioner and you're looking to start a conversation about diet before you begin, make no assumptions about what someone eats and why they eat the way they do. And also don't assume that they are ready to change or that they're not ready. Ask for permission in a non-stigmatising way. Be transparent about why you're raising the issue so that they can make an informed decision about their willingness to discuss diet and weight in the context of lymphedema management, and respect their decision. An initial refusal doesn't mean that you can't ask to discuss it again at a later date. It might just be that trust needs to be built, and or the person has other priorities in the first instance, or the timing isn't right due to personal challenges, for example. When looking at a diet, whether that be your own or a patient that you're working with, focus on the quality of the diet in the first instance and start working towards the principles of the Eat Well guide. As dietary quality improves, it's likely that many other benefits will start to be realised. For example, improvements in energy, mood, etc. And it's likely that these will have a positive knock-on effect. Also think about individual preferences and goals. If quality has improved and weight loss remains a target, then it may be that we need to start tweaking some of these. All diets and supportive strategies have their own merits and barriers. Individual priorities and the factors previously mentioned will help to bring the right strategy to the fore. Then a collaborative plan can be developed and a long-term supportive strategy can be put in place that will enable long-term change. For example, it may be that an app that allows you to record what you eat provides you with a mechanism for reflection. And many apps will tell you if you're meeting your nutritional requirements and will issue push notifications to encourage and motivate. Wider support structures that bring in family or friends can also be helpful, and reflecting on how and when you eat and changing how a day is structured may help overcome mood-related eating. And so now I'll pass you over to Justine, and she will tell you a little bit more about why diet and weight should be a part of lymphedema treatment.
Thank you, Debbie. Hi, I'm Justine, and I'm going to take you through the next two objectives of this webinar. So to understand why a healthy diet and weight management should be considered as part of a lymphedema management programme, we need to look beyond the area of swelling or the limb that's swollen and take a step back and look at the whole person that's in front of you. Current models of management, particularly in non-specialised areas that don't have a lymphedema specialist lead, are very limb and swollen area focused, just looking at that area that's swollen and trying to reduce it and trying to maintain that. And that's great, and it's all well and good if the cornerstones that are available and recommended for treatment are very good and are adhered to, but they don't necessarily look at the bigger picture. And nutritional support is often lacking in these cornerstones and therefore not providing a full package of care to the individual that's there to receive it. So let's not forget that one of the main functions of the lymphatic system is actually to deliver nutrition from what you eat by fat absorption in the gut and transport it back to the circulation. And we know as well through recent science and publications that lymphedema is in fact an inflammatory based condition. And it's typically characterised by chronic inflammation of the involved cellular matrix with a progressive tendency to transform itself then into fibrotic lymphodematous tissues. So that's the thing that we see where the disease starts to become progressive and move through the stages of lymphedema. More generally, the systemic low-grade chronic cellular inflammation is definitely linked to ageing. We know this is proven, and multiple chronic degenerative diseases such as diabetes and metabolic syndrome, atherosclerosis, so that's your arteries starting to fur up, and neurodegeneration, and also, of course, cancer. And the human gut microbiome has emerged as an equal cause of disease and a cofactor on the same axis as it's associated with diet and cardiometabolic conditions. So if we begin to think about managing inflammation first and foremost, we can consider our approach not only to manage health on the whole body level systemically, but also more on the localized area, such as the area where your lymphedema is, therefore promoting a healthy tissue environment. So let's consider inflammation as a friend or a foe, in evolutionary terms, of course. As a friend, it's our natural physiological response to protect us, and our bodies, the whole time it's protecting us against infections and viruses and bacteria and injury. When any of these things are exposed, the immune system's triggered off that inflammatory response. But as a foe, it's now one of the biggest causes of ill health, and it's initiated by what foods we eat and how our bodies metabolize these. So that constant activation on the inflammation by the types of food we eat results in an insulin resistance, which then, and also a higher blood pressure and higher blood fats, which in turn have a direct effect on our lymphedema. And as do some of these drugs that we use to manage the condition, like high blood pressure. We certainly know that the calcium channel blockers that are used to reduce high blood pressure have an immediate effect on slowing the lymph system down, because that pulsation within that lymphangion is governed by calcium. So if we start to slow the calcium firing down, then we'll slow down the lymph system as well. So the top killers in the Western world, we've kind of alluded to them already, are cancer, stroke, cardiovascular disease, type 2 diabetes mellitus, Alzheimer's and chronic kidney disease, and they're all caused by chronic inflammation. So what used to be our protective friend, and still is in small amounts as necessary, particularly with bacteria, is now our foe, and that's due to our perpetual activation. Food has to be seen as a medicine, as it's all ultimately chemistry, and we need to become our own dietary pharmacists and understand the goodness in food, and also when the food isn't good, when it's highly processed, and some of the things that Debbie's talked about is what's firing off this inflammation. So objective 4, which is our final objective of this seminar, continues by considering education. So by taking all the information from this webinar and reading further into the references that we've provided, you can begin to put together a package of information for your patients on how what they eat affects your lymphatic system. So all through this webinar, it's purposely not focused on managing obesity, but we can't fail to mention it, and I know Debbie's mentioned it also throughout some of her objectives. And we can't not discuss it when we're looking at what we eat and drink with regard to lymphedema. And with this in mind, it goes to the next for the cornerstone 2, which is weight management. And Debbie's already mentioned it, but I'm going to give it a second plug. And that's the BLS document, The Impact of Obesity on Lymphedema, which obviously just came out as a consensus document last year. And it's a must. It's a bestseller in my view. So please visit the website to download your PDF copy, and it'll give you a plethora of information to support your patients. Self-massage and mobilising the tissues in a way which enhances the lymphatic pump and movement can only be a good thing. It makes sense to respect the body with nutritional nourishment and hydration. And drinking water and remaining hydrated is essential for life. And we only get one go at this, so let's make the most of it. So any sort of movement and exercise is going to be good for you. And of course, we've got a whole webinar on exercise for that. So Debbie and I have got a couple of take-home messages for you, and that's really all that we have to say, and we're going to be available for some questions. So my take-home message for you to pass on to the individuals that attend your services is to seriously consider the need to morph dietary change naturally into your lifestyle at a pace that will become a habit, a good habit, and not a fad. And Debbie's take-home message is give some serious thought to why you want to change. What's your ultimate goal? And then think about how each of these changes will help you reach that goal. So thank you all for attending today, and we invite you to just stay online, and we're happy, the two of us, to answer some questions for you. So thank you very much.
Much, Debbie and Justine, for such an engaging and interesting introduction to how what we eat and drink impacts on lymphedema and its management. There was a lot of scientific information there to take on board, but also the take-home messages I found really, really helpful in trying to understand those messages and make it a bit easier for us to think about. We've got loads of questions for you both, and I know you're both happy to get going. So let's start. And two people, well, including myself as well, so three of us want to know, Debbie, what's wrong with tuna in a tin?
I saw that, and actually, there's nothing wrong with tuna in a tin. What I guess I should have said more clearly is that we recommend about 2 portions of oily fish a week. And that's because the oily fish itself has additional health benefits in relation to heart health, cardiovascular disease, etc. And it's just that tinned tuna doesn't have a lot of oil left in it because of the processing that it goes through. But fresh tuna, sardines, mackerel, all of those things all have a good amount of oil in them. And actually, tinned mackerel, tinned sardines, and things like that are actually fine because they tend to be those kind of whole fish. So they maintain some of the oils that are good for you. So have canned tuna, but it doesn't count as one of your oily fish.
Oh, that's brilliant. Thank you so, so much. And for both of you, are there any supplements that we should be recommending to patients living with lymphedema?
Generally, I wouldn't recommend any supplements unless there's a specific reason as to why you may be deficient in something, with the only exception being vitamin D. So living in the UK, we don't tend to get a lot of vitamin D from sunlight, and of course, sun safety requires us to use SPF and things like that that stop you from getting the vitamin D. So I would recommend some vitamin D supplements, particularly in the winter, but for those further north like me throughout the year, it's not a bad thing. But other than that, I wouldn't recommend a supplement, as I said, unless there's a reason why you might be deficient in a particular nutrient because of another underlying condition or something.
What about those supplements that... Oh, sorry, Justine.
Yeah, no, I was just going to add to that.
Yeah.
I agree there, Debbie. And I think if you want to look at enhancing certain things, because we know they complement sort of the lymphatics and that immunity, such as things like selenium, where you can, you should be taking that from the natural food source rather than getting a synthetic copy in a plastic capsule that you've got to then deal with as well. So, for example, if you want to get your daily allowance of selenium, then 2 Brazil nuts will give you more than enough selenium for that particular supplement. Unless, of course, you've got a nut allergy, then that's where there's exceptions. But where you can, if you are learning that you need to supplement, then you should be getting that from the natural food source wherever possible, really.
And what about those sort of probiotic gut supporting sort of products that you can get? What about those?
Do you want to talk to that, Justine, or do you want me to?
Well, you start and then I'll add if there's any extra.
Yeah, I mean, I think a dietitian generally would always recommend that you try to get as much nutrition as you can from your food. It can be quite tricky, and sometimes there are occasions, if you've been using antibiotics, for example, where it will have affected your gut health and you might want to replace some of those good bacteria, and a prebiotic might be a good shout in that instance. I think that, again, trying to get as much of a balanced diet, going for a real variety of plant-based foods as much as you possibly can, is a really good thing to do for general gut health. And I think that the thing that we often do is we jump to sort of supplements for these things. And actually, you get a lot more, and that's what Justine was kind of implying there, talking about sort of selenium from nuts. You get a lot more from the whole food than you do from the individual nutrient itself. And the more variety you get, those foods all start to interact with each other, and that's where you then get the benefits, where the nutrient in one foodstuff is actually supporting the absorption of food from another source, or a nutrient from another source. And so it is really good for you to try to eat that balanced diet and to enjoy your food rather than thinking about it as being individual nutrients that you're trying to get for specific reasons. So again, it's not, I wouldn't say there is any harm in taking a probiotic or a prebiotic or symbiotic, but other than the fact that it has financial implications, but it's good to try and get as much as you possibly can from your food, unless there's a reason why you may need to readdress the gut microbiome because of specific conditions, an infection, or use of an antibiotics or something like that as well. But Justine might want to add a little bit more.
Yeah, I totally agree with everything you've said there, Debbie. And I think really just to add to that is that you need to be careful about the modality that they're being delivered in. Some of them are tucked away in quite highly calorific mediums of drinks, and also a lot of these things are really highly processed. They're come in beautiful packaging. They're very expensive. The internet is every single other feed on any of my social media is trying to tell me I need magnesium. It's trying to tell me to put sprinkle this on my food and chew this mushroom gummy, and all this. They're all processed foods at the end of the day, and anything processed is exactly what it says on the tin. It's gone through a process to modify it in some way. So where you can get it naturally, and that's often the cheapest way of getting it into your system. But just really to reiterate, it's the variety of what you eat. So there was that huge push for 5 portions of fruit and vegetables a day. That's the minimum we should be taking. And that's not the same fruit and vegetables that we should be having the same day. So if you have carrots every day, you're still just having one variety. What you need to be trying to do is increase the variety, and that includes herbs and spices and anything, nuts, fruit, veg, salad. It's very easy to start to get that variety in. And a lot of the supermarkets, particularly the Aldi's and the Lidl's, they have these bargain boxes on a regular basis. When you go in, you can have a huge veg box for £2. There's a lot of opportunities. Even if you just make a massive big pan of soup with that, just boil the lot up and eat that. There's a lot of goodness and food in that, which gives you those varieties and nutrients that you need that all interact together. So yeah.
Thank you both. I think that's something that people get asked a lot, is about supplements and about what to advise. And I think that's really good that we've covered that topic. But what's interesting now is moving on to something around sleep. And is there anything that we know about, any evidence or literature that shows that getting very little sleep or working and sleeping in different shift patterns does affect a person's dietary intake and nutrition, and that might be something we would need to advise on in managing people living with lymphedema?
Yeah, am I okay to start with that one, Debbie? I think what we need to do is peel back to, again, anyone that knows me knows I like a bit of biology. So we recently brain lymphatics have been discovered, and they're called let me get this exactly right. glymphatic, so GLYMPHATIC, and they are really starting to be the new kid on the block from a research perspective, because they are in the brain, but they only work when you're sleeping. So it's a nighttime clearance of the lymphatics. So we know that if you're not sleeping, your body isn't functioning. And that then ultimately, I mean, this is a real kind of quick flow chart because it's a lot more complex than what I'm going to say, is that when you've got lethargy, you've got anxiety, you've got higher levels of cortisone in your body. All of these things have an impact on cardiovascular, on all those diseases that I mentioned within that little webinar. We're very complex humans, and yeah, so that's where we're starting to see the link. We're also starting to see that linking with dementia as well, and also by improving sleep, people are starting to see improvements in diseases. So it's certainly going. I don't think there's anything really very specific. Debbie might correct me on this from a study perspective, but because we know about these things that we're starting to unpeel at scientific, by physiological level, these are the questions that we're asking are certainly going to be the things that are going to start firing off new pieces of science and research. But yes, sleep is so essential for your lymphatic system. And we've always known or felt that, but now we're getting that hardcore science behind it to support it. So that ultimately does have an effect on, when you're hungry and tired, you don't feel like conjuring up the most beautiful Michelin star chef meal for your family on a Tuesday afternoon when you've just done 14 hours in clinic, and the patients are the same and they don't have access to lots of things. So, lethargy is a huge impact on diet, and then obviously metabolism and how we process that. So I don't have anything extra to add on that, Debbie.
No, I don't think there's a huge amount. I think, again, I would agree with what you've said. And I think that there are some studies that have shown that shift work is associated with obesity and cardiometabolic regulation. And so it definitely is something that is an issue for people. And as you said, Justine, sometimes it's to do with the tiredness and the energy levels, and that then impacts on food choices. And the other thing is the longer you're awake, the more likely you are to snack. So there's some basic things in there in terms of what a dietary intake might look like as a result of lack of sleep and tiredness, the amount of hours awake, and the knock-on effect on the whole body and the way that it metabolizes food.
Yeah,
that all makes
perfect in the sun, and I don't want to not be in the sun, but I can't see you. Sorry about that.
We won't have any complaining about the sun, Justine. We're talking about vitamin D today, and we've all got a little bit of it. Justine, I'm going to come to you around anti-inflammatory now. You talked a lot about lymphedema being an inflammatory condition and the way in which this manifests itself. And we've had a couple of questions around that. One is around, are there specific foods which are good at being anti-inflammatory? And I know, Debbie, you'll have something to add to that as well. And then are there certain foods that trigger inflammation, so that should be avoided, I guess, in people living with lymphedema? So if we can touch on those things for both of you, I don't mind who goes first, that would be great.
Yeah.
Go ahead, Justine.
Yeah, certainly, and I think it's very well known that things that we probably enjoy the most, like fatty foods, and one or two I keep seeing about alcohol in the chat as well. Yeah, there are certain foods that trigger off inflammation within the body. Usually, it's an excess of food, of excess portions of anything. And foods that are generally lacking in nutritional value are likely to be the inflammatory triggers. So yeah, a lot of fatty things. Our bodies are all completely different. So one kind of diet won't fix all. It has, and that's where that discussion with, if you're lucky enough to have a dietitian on your team to get that information. From a anti-inflammatory perspective, the brighter the colour, the better it is likely to be for you. So your beetroots and your coloured fruits, they're full of polyphenols, so they have a natural anti-inflammatory component to them. And again, it's about having pure food. More than anything, there's if any of you follow my Facebook page, you'll see that I'm often down at the market buying vegetables, just to then go home and show you how to make something really nutritional and filling that'll last you all week for less than 20 quid. So it's because it's pure food that you're buying, and not all this packaging and the processing. So anything that's processed is, there's, look at your packaging. There's also these additives that are in. They're all inflammatory driven. So yeah, I would say from an alcohol perspective, just to cover that, because I know Hayley's mentioned it and a couple of others, is that anything in excess, like I said at the beginning, is not going to be good for you. If you're gonna have alcohol, then the one thing that has been shown that it's okay in slight moderation, as in no more than one small glass a day, is red wine, and that's because it contains your polyphenols. But again, yeah, that is absolutely one of those huge things. Is alcohol? Alcohol is what do they used to say? The root of all evil. But it's often the first thing people go to grab when they come home from a hellish day at work. But it's about having those individual chats with patients to break those habits. You want some, that cold beer fizzy hit, or cold glass of prosecco hit when you come home from work. Have a bottle of fizzy water in the fridge. Anything fizzy isn't great because it's got all that carbon dioxide pumped into it, but it's a good way of weaning things off. And if it's just got that little, squeeze some natural lemon or lime juice in there as well, just to give it that little extra natural nutritional value. But yeah, that would be, I'm sure Debbie's got some extras on that with the foods.
Yeah, I mean, I think from a food perspective, as a dietitian, we're often keen to think about what you can add to your diet rather than necessarily what you can take out of it specifically. And I think from an anti-inflammatory perspective, I touched on it a little bit, talking about the Eat Well guide, but also talking about the Mediterranean diet, and the Mediterranean diet is a bit more of a shift towards more of those kind of anti-inflammatory foods, I guess. And it is very much a diet that's rich in fruits and vegetables, but also has unsaturated fats in there that's going for like your extra virgin olive oil as your main fat source. Very lean foods and fish, as I said, and I know that there's a couple of people in the chat that have said if you don't like fish, or you don't eat fish, then where can you get those sources? And seeds and nuts are very good source of your omega-3s and your omega-6s, from an anti-inflammatory perspective. So I would encourage that. And I think the other thing to think about in context of all of this around diet is actually also the physical activity that goes alongside it, and the difference that physical activity can make to cholesterol levels, and also appetite regulation as well. And so it's about the balance of exercises as well as diet, and trying to bring in that sort of healthy approach to life more generally.
And that hydration as well. I know
Yeah,
you mentioned
absolutely.
that in your talk, but having people, a number of patients that come into clinic, and I don't know whether it's become a formed habit because they feel that if they drink more, their legs are going to swell more because they've got extra fluid, and that they can possibly utilize that. But there's, usually they're not hydrated properly, and we should be looking at 1.5 to 2 litres of fluid a day. That's not beer. And it's dead easy. It was dead easy yesterday, wasn't it, on Paddy's Day, to think, oh, we'll just have 3 or 4 pints of Guinness, and then that'll tick my fluid thing. But yeah, there's a bit of nutritional value in Guinness, but yeah, mainly we're talking water here, and if you can't just drink pure water, the number of people that say they don't like water, which astonishes me, because it's just the most beautiful, purest thing we've got on earth, and the one thing that will keep you alive longer than anything. That if whatever you're putting in it, to make it tolerable, make sure that it's not too sugary or too acidy, and not too much of a diuretic effect on that as well.
Thank you. You've both touched on the difficulties around perceived cost of eating well, around the social, financial, and psychosocial impact of all of these things. And we've had a couple of comments around preparing food, sort of meal prepping for the week, being able to, as you said, Justine, do a big stew or a soup. And the ingredients about using fresh and frozen also comes up a lot, about people saying, well, the frozen can't be as good because it will have lost some of its nutrients, or freezing food after we've meal prepped it. Have you got any advice that we can give to the people that we're helping to support with their weight management around those issues? Debbie?
Yeah, absolutely. There is nothing wrong with a bit of batch cooking and some freezing. Absolutely not. And I think that obviously, again, you do need to think about what people have available to them. And I think that goes back to my point that I made in the presentation earlier around the importance of a real holistic assessment, because there are reasons why people eat the way they do, and we assume that people have access to enough fuel to be able to cook on a regular basis, that they have a fridge or a freezer available to them to be able to then store food that's been batch cooked, etc. That they have access to shops that have fresh fruits and vegetables and produce that's affordable to them and enables them to have that balanced diet. And these are all assumptions that are not necessarily borne out. So it is really important to sort of understand that, so that you can then start to support somebody to make the right changes to their diet that are practical and possible for that individual. In terms of canned foods, there's absolutely no problem with canned foods. What I would say is, if you're looking at something like a tinned fruit, for example, that you're looking for it to be tinned in juice rather than in syrup. And again, just be very mindful of the sugar content that comes with that volume of juice and that volume of fruit. So it's about the portion that you're having at any one time. And then sometimes when it comes to sort of fish, then again, you might get that tinned in brine rather than water, spring water. The water is better, the brine is more salty. So again, something to think about from just a sort of blood pressure perspective. And the same when it comes to tinned vegetables and things, they're absolutely fine. But again, just look at what they're tinned in. And frozen is great. Fresh is also, sometimes frozen is better than fresh, because it depends how long the fresh has been sitting for. So absolutely no problem with that at all. And things like nuts and things can also be quite expensive to buy. But you only need a very small portion of them to get a really rich amount of vitamins and minerals and also calories. So it's something to think about, that actually nuts and seeds are very energy dense. So again, if you're taking them as a snack, but you're trying to watch how much energy you're consuming over the course of a day, then these are things to be mindful of. Yeah, hopefully that's a few sort of practical hints and tips
Absolutely
there.
brilliant. That was such a whistle-stop tour on how to, to really consider and to give advice to people in that way. I can't believe it's 1:45 already.
Have I got time just for one little extra point on that?
Very quickly.
Just very quickly. One is that quite often, if you're buying frozen peas, they're frozen within 90 minutes of being picked. So the nutritional value is probably better than when you're just buying them even in the market, because that could have been the day after. So, and the other thing, I've just popped it in the chat. I've put Sewing Rooms in Preston. There's a charity in Preston that make cooking bags. So the economics of cost of cooking things these days is huge on young families and on working families as well, anybody. So we've just done some research on it at the university as well, but it's based on a concept from Africa. So it's used in third world countries, and several millions of these bags have been made and used. So you would bring something up to temperature within about 10 minutes, such as rice or a casserole. You then pop it in this drawstring food bag that's insulated, and it will continue to cook the food for the next 6 to 8 hours. So you can travel with that. You can do it 10 minutes in the morning. It's like a free slow cooker, if you like. And so you've got your rice ready, you've got casserole ready, and it's still at temperature that's acceptable. They're about 50 or 60 quid, I think, but these women. So just if you get a chance to have a little look at the sewing rooms in Preston, that's the UK base.
There's also a really good website that says Too Good to Throw Away, and you can sign up and you can get things at the end of the day that are reduced, which is good. So I'm really sorry we're a minute over. Thanks again to Debbie and Justine. Absolutely amazing. We could keep talking for hours, I'm sure. Our fourth and final webinar of Lymphedema Awareness Month is next week, Wednesday, the 24th. I think I'm right in saying, or 25th, Wednesday the 25th, at 12 p.m. So please join us for that. That's looking at getting the most out of your lymphedema treatment, with Natalie Phillips from Hadnam Healthcare. And if there are non-specialists on the webinar who would like to learn more about lymphedema, the BLS has 2 study days coming up this year, one in Bristol on the 4th of June and one in October, on the 5th of October in Chester. And we really would love to see you there. There'll be a link in the chat for you to register. But thank you all so much. I hope it's been really useful. It certainly has been. I've learnt loads. So take care and hopefully see you next week. Bye now.